So welcome everyone to our weekly UCSF Orthopedic Surgery Grand Rounds. Today we have one of our own faculty members who will be presenting. And for an introduction, I'll turn it over to Dr. Pandya.
Great, thanks, Drew. Today I have the pleasure of introducing Dr. De Borja, one of our partners. She's a pediatrician who has specialized training in sports medicine, who cares for all ages of patients over here in the West Bay and in the East Bay as well, too. In addition to doing general pediatric orthopedics, obviously her specialization is youth sports medicine, dance medicine, injury prevention, and bone health. She's originally from the Philippines. She earned her MD from the University of East Ramon Magsaysay Medical Center. She completed her pediatric residency at Hackensack Meridian at Jersey Shore Medical Center, then completed a fellowship in sports medicine at Boston Children's Hospital. And because of that, we also were able to have Dr. Watkins come, who is a fellow the year after her as well, too. Dr. De Borja has been amazing for our program. One of the things that we've tried to do as we develop a comprehensive pediatric sports medicine program is really cover all aspects of it. And having someone who is a primary care sports medicine provider has really allowed us to provide that comprehensive care, whether it be concussion management, nutrition, bone health, female athlete issues. I think it's been tremendous to have her and Dr. Watkins join our faculty. So without prolonging this anymore, I want to introduce Dr. De Borja to you, and she'll be talking about youth sports medicine.
Thank you, Nirav, for that kind introduction. Good morning, everyone. It is my pleasure to present at our orthopedic department grand rounds today on a topic focused on youth sports medicine. And while it may sound clinically relevant for a select few in our department, I hope that as I present this information through a pediatric primary care sports medicine lens, that everyone can bring home some useful information that they can share with their families and communities. So I'll start by describing the current state of youth sports participation in the United States. I'll discuss the many benefits as well as the challenges that we see with physical activities in youth and teens. And then I'll end by sharing some recommendations for safe sports participation in children and adolescents. There are currently 73 million children in the United States. That makes up 22% of our population. And while the proportion of children has been decreasing in the last decade, we're seeing an increase in sports engagement. There has been this shift from neighborhood pickup games to organized sports that are driven by coaches and parents. And there's been a special attention or focus on skill development rather than overall fitness, especially at younger ages. 73% of children who are school-aged from 6 to 12 reported participating in either a team or individual sport in 2019, with bike riding as the most common activity, followed by team sports like basketball, baseball, soccer, and football. Similar trends were seen in the teenage population. While the participation for the teenage group has been increasing over time, we are seeing a gap between boys and girls' participation in sports. Why more teenage boys participate than girls could be for a variable different reasons, which could include girls' preferences, access to community offerings, or societal stereotypes. However, I'm hoping that with the positive example of successful female athletes, that this will change for the better in the future. The physical benefits of youth sports participation has been widely documented and well established, especially in musculoskeletal health and cardiovascular health. In children specifically, it helps with the development of gross motor skills and hand-eye coordination, and has also been found to contribute to healthier eating practices, specifically lower soda consumption, eating breakfast, eating more fruits and vegetables, and drinking milk. Youth sports participation can also help in children's cognitive growth and development. Student athletes were found to have improved academic performance, attitudes, and classroom behavior. They have increased interest in school, desire to maintain eligibility, and heightened sense of self-worth because more people are now invested in their academic performance. And this also holds true for our children from low-income families. High school athletes are also more likely to attend college and get their degrees compared to their non-athlete peers. The psychosocial benefits of youth sports participation cannot be overstated. There's plenty of positive correlation between regular exercise, mental health, and personal development. Student athletes are less likely to experience loneliness from low self-esteem, and team sports participation has been found to be protective against feelings of hopelessness and suicidal ideations in middle school athletes and high school athletes. And again, these benefits hold true for those from low-income families, as well as children with developmental delays who participate in the Special Olympics. Student athletes are also less likely to participate in risky behaviors, such as smoke cigarettes, use illicit drugs, unsafe sexual practices, or carry weapons. However, it is important to know that they are more likely to binge drink alcohol and use smokeless tobacco, especially those that participate in contact sports like football, lacrosse, or wrestling. The benefits of youth sports participation may extend into adulthood and may be applicable towards life skills and career building. Teens who are active are 8 times more likely to be active when they turn 24. And most of adults greater than 30 who are currently physically active report sports participation in their childhood and adolescence, which is important in reducing obesity, preventing hypertension, and other chronic medical illnesses. Because active children tend to become active adults, the benefits of youth sports participation is not only limited to the individual, but can extend into the community as well. The estimated effects of physical inactivity through healthcare expenditure and productivity losses was calculated conservatively to be around $6 to $8 billion globally and $28 billion nationally. In the United States, this is mostly covered by the public and private sectors, while 11% is covered by the individual households. Through their calculations, they estimated that each individual can save up to $2,500 annually if they only commit to moving at least 30 minutes 5 days a week. However, with everything that's considered beneficial, there's going to be plenty of challenges. And we currently live in an age or a society that is heavily dependent on technology. And so our children are spending more time on their screens on activities that are not school related. It also sometimes causes them to be less active, with only 24% of children reporting physical activity of at least 60 minutes every single day. As seen on this figure on the right lower corner, the section in yellow and orange shows that there's disparities in youth sports participation, specifically due to lack of access for physical space and safe space for children of color and those from lower socioeconomic backgrounds. These resource-limited children may rely on school for physical activities. However, there has been a steep decline in physical education classes in the recent years, from 41% in 1991 to only 25% in 2019 of children reporting having PE classes every single day, and only 52% of children reporting having PE classes at least once a week. Because of these limitations, the cost of youth sports participation has burdened the individual household. In 2019, a household spent an average of $1,500 per year just on club sports. And this is just the average. Numbers can go upwards of 5 figures. Spending is mostly on travel, equipment, private coaching, camps, and registration fees, leaving out those who can't afford with very few, if not none, opportunities. In that same year, about 33% of children from low-income families were considered physically inactive, compared to less than 10% of children from households making more than $100,000 annually. Of course, we can't have a sports medicine talk without discussing sports injuries. According to the CDC, more than 3.5 million children under the age of 14 receive medical treatment for sports injuries annually. More than half of these injuries are considered preventable, and overuse injuries are responsible for nearly half of all the injuries sustained by our middle school and high school students. Children are at increased risk of injuries because they are skeletally immature. They have open growth plates, they're ligamentously lax, they have underdeveloped muscles, which can also lead to poor technique, in addition to normal variants of anatomic alignment that can be seen during normal growth and development. Extrinsic factors that also increase the risk for overuse injuries include rapid increase in training. This was especially prevalent in the spring and summer of 2021, as children rapidly or eagerly returned to sports after a year-long lockdown. Those who train more than 16 hours per week and the younger children who spend more hours per week than their age and years in sports are also more likely to sustain overuse injuries. And even if you account for exposure or hours per week, we've recently found that early sports specialization could be an independent risk factor for overuse injuries. For those who haven't heard of the term, early sports specialization is this new training method that's followed by young athletes who aim to achieve elite level success. There's a couple different definitions in literature, but the general idea is that a young athlete chooses a single sport, quits all other sports, and participates at a high level all year round or more than 8 months in a year. And they can do so by participating through their school, through their clubs, or traveling with other teams. There's no specific age for what early means in sports specialization yet. The American Orthopedic Society for Sports Medicine mentioned specializing before the age of 12, while the American Academy of Pediatrics and the American Medical Society for Sports Medicine mentioned specializing before adolescence. Approximately 10 to 30% of children between 12 and 14 years old are considered specialized in the United States. This was traditionally seen in those who participate in individual and technical sports, with gymnastics and dance as earliest specializers at 8 and 10 years old, respectively. However, this trend has started to change for those who participate in team sports, particularly in baseball pitchers and soccer athletes. Where an athlete lives can also influence their specialization practices. Studies show that high school students in suburban regions participate in more competitions compared to their rural counterparts. They're more likely to play in a league outside of school and train more than 16 hours each week all year round. Studies also found that high school pitchers who live in warm weather regions pitched an average of 9 months a year, which is significantly greater compared to their counterparts who live in cold weather regions, who only pitched 6 months a year. And this is obvious, right? Because it would be more conducive to year-round participation in a warm weather region. Socioeconomic factors can also influence specialization practices. As you can see here in the middle, as socioeconomic status increases, so does specialization practices increase. As you can see on the left, athletes who are privately insured are also more likely to specialize compared to their colleagues or peers who are on public assistance. When asked about their attitudes or beliefs towards sports specialization, 79% of high school baseball parents and 86% of youth basketball parents reported that they believe that specialization would increase their child's chances of getting better, while only 41 to 47% of these parents believe that specialization would increase their chances of injury. Similar results were seen when the club athletes were asked themselves. And you may wonder how we got here. How did well-meaning families or parents end up in this situation? And the reality is that there's been a change in youth sports culture. Youth sports is now a multi-billion-dollar industry in the United States that is fueled by organizations that do not always align with the long-term health and development of its participating youth. It's more than just organizing local or regional tournaments. There's tech money involved too. They're live streaming the events, thereby generating income from selling ads. They're creating apps that track the athletes, that track their stats, that track the tournaments, and where the next college recruitment is going to be. There's special focus on elite status and performance that's reinforced by social media, college scouts, and professional organizations. And this has created a frenzy that has caught the attention of parents who will do anything for their child to succeed. While those stories may sound impressive, the statistics show us a different reality. The chance that a high school athlete will play and get an athletic scholarship in college is about 1%. The average athletic scholarship is less than $18,000, while the average tuition fee for public and private colleges are around $22,000 and $36,000 respectively. And even if the child plays in college, the chances of playing professionally are very slim. And while some parents may say, well, my child's worth it, I'm going to do whatever it takes because I believe that they can be that 1%. But more studies are coming out suggesting that early sports specialization may not even be necessary, especially because it does not ensure sports success, except maybe in a few individual sports, such as gymnastics or figure skating, wherein development of technical skills is necessary before the end of puberty. What's been found to be beneficial or linked to sports success is family history, suggesting that genes play an important role in an individual's athleticism. A study on Danish elite athletes revealed that successful athletes specialized later and trained less compared to their near elite peers. Another study on Olympians who competed in 2004 reported that the mean or average age of sports initiation was at 11 and a half years old. And an older study on Division I athletes revealed that 70% did not specialize until after 12, and that most of them played more than one sport in high school. 40% of these athletes also reported that they had a parent who competed at college or professional level, supporting our genetic theory. A newer study on former NCAA athletes who competed in between 1960 and 2018 revealed that only 18% of these athletes specialized before 15 years of age. Specialization was more common amongst female athletes and those who participated in individual sports, such as gymnastics, tennis, swimming, and diving. However, this was one of the first studies to show that soccer athletes have also been specializing early. In addition, this was also one of the first studies to show the trend towards earlier specialization for more recent college graduates. According to their study, there's no difference in scholarship attainment between the two groups. And while the injury profile was not statistically different, burnout was more common amongst those who specialized early. A study on NBA first round draft picks from 2008 to 2015 revealed pretty high specialization rates, up to 85%. However, their study found that it was the multi-sport athletes who were less likely to sustain a major injury, played more games in the NBA, and had longer professional careers. Another study on professional baseball athletes who participated in the Atlantic League in 2016 revealed that almost half of the athletes specialized before high school. These athletes, however, reported more serious injuries that required rest from sports for an entire year. What was interesting about this study is that 63% of all the athletes surveyed did not believe that early sports specialization was necessary to master the skills needed to play at the professional level. The problem with early sports specialization is that lack of diversified activity may not allow for appropriate neuromuscular skills that are effective in injury prevention. In other words, we're teaching the young baseball pitchers to throw faster at higher skill levels without focusing on cardiovascular fitness and core strength, which are very important in injury prevention. Using the same segments of the body without much rest also increases their risk for physical injury. Going back on this figure, as you can see on the right side, as specialization practices increases, so does risk for serious overuse injuries. And by serious overuse injuries, we're not just talking about Osgood-Schlatter or Sever's apophysitis. We're talking about injuries that require at least 1 month of rest from sports, including spondylolysis, stress fractures, osteochondritis dissecans, or ligamentous elbow injuries. There also seems to be a dose-dependent effect on the degree of specialization and their risk for serious overuse injuries. Those who meet criteria for being highly specialized, so checking off 3 out of the 3 components of the definition, have significantly increased odds of sustaining a serious overuse injuries compared to their non-specialized peers, even after accounting for exposure or hours per week in sports. The link between early sports specialization and physical injury has gained the attention of sports medicine research and policy development. However, far less attention is given on the psychosocial effects on our young athletes. Prior position statements have suggested that youth sports specialization is associated with increased stress and can lead to burnout. However, our current evidence is limited, which is why I want to spend a little bit more time on this to increase awareness and also encourage discussion. Before we focus on the athletes, I just wanted to highlight that mental health conditions aren't uncommon in pediatrics. 50% of individuals with mental health conditions will first show signs by 14 years old or in their teenage years. And 75% will begin by 24 years old or their early adulthood. There's numerous studies suggesting that early intervention can help prevent negative functional and developmental outcomes. However, less than 20% of children and adolescents are receiving treatment. Although sports participation has its psychosocial benefits, it does not mean that athletes are immune to these issues. The competitive nature of sports can provoke or exacerbate any underlying psychological issues. Certain personality traits, for example, perfectionism, which may help with athletic success, can also be associated with certain mental health conditions. And lastly, the athletic culture that traditionally downplays mental health concerns and instead focuses on playing for scholarships or meeting expectations of families and coaches are also contributing factors to the mental health issues in youth athletes. However, we're learning more and more each day that even those that are considered the greatest of all time in their respective sports are also vulnerable to these issues. Injuries may trigger or unmask mental health conditions and may influence recovery, including their post-operative outcomes. So as orthopedic and sports medicine specialists, we may be at the front line of identifying these issues. It is important to remember, though, that underreporting may be higher in student athletes because of the social stigma. In addition, the college female athletes may also prefer discussing these issues with physicians of the same gender. Sleep is an essential component of an athlete's health and well-being. Recent studies show that middle school athletes who trained more than 10 hours each week slept half an hour less each night. The American Academy of Pediatrics recommends at least 9 hours of sleep for school-aged children and at least 8 hours of sleep for teenagers. However, the same study found that 26% of middle school children and 45% of high school children were not getting their age-recommended amounts of sleep. After they adjusted for age, gender, homework load, and internet use, they found that those who participated in sports competitively and those who reported mental health symptoms such as depression and anxiety were less likely to get their age-recommended amounts of sleep, suggesting that increased training loads can lead to inadequate sleep, which can overall affect an individual's mental health. Factors unique to athletes that increase their risk for mental health issues, specifically anxiety, include fear of failure, perceived negative consequences of performance, social judgment from the crowds, coach, or their teammates, and injury history. While it may be difficult to detect pathologic anxiety in athletes, especially in competitive environments, we should remember that athletes are most vulnerable in the setting of an injury. And it's more than just excessive worry or tension that is seen as a response to an injury. In a recent study, about 75 to 87% of young athletes who sustained an ACL rupture reported avoidance symptoms, symptoms of intrusion, and hyperarousal, which are the most commonly seen symptoms in post-traumatic stress disorder. These PTSD symptoms are more common in female athletes and those with higher athletic identity. A systematic review on return to play after ACL reconstruction revealed that 37% of athletes were not able to return to their pre-injury levels. And 65% of these athletes cited a psychological reason, most commonly fear of re-injury and lack of confidence, while the rest reported depression and lack of interest or motivation. The rates of depression amongst college athletes have been increasing compared to what's been previously reported. In a recent large multi-year study on Division I athletes, they found a 23% prevalence of clinically relevant depressive symptoms, which is similar to the general or non-athlete college population. Depressive symptoms were more common amongst female athletes, younger athletes, and those who participate in individual sports. The prevalence of depression also goes higher when studies focused specifically on injured college athletes. Factors unique to athletes that increase their risk for depression includes injuries that cause time away from sport, especially when their injury requires at least 30 days of time off. Time demands on the student athletes. So college athletes may spend about 40 hours a week training and competing for their sports on top of their academic responsibilities, performance expectations, and athletic identity. Depression in athletes may present atypically, such as musculoskeletal pain, chronic joint pain, or back pain. These may be difficult to recognize on the initial evaluation, however, should prompt suspicion, especially when it's interfering with optimal recovery and return to play. Mental health screening tools have now been included to our youth sports physicals, as recently updated by the American Academy of Pediatrics. The Physician Health Questionnaire 4, or PHQ-4, has 4 questions. The first 2 questions screen for anxiety, while the latter screens for depression. Anyone who scores 3 or greater should warrant further discussion and an appropriate referral. If formal mental health constructs may seem outside the scope of your practice, then the BATHE method, or asking these 5 simple questions, can be extremely useful in reducing the stigma, encouraging dialogue, and acknowledging the impact of mental health on an individual's wellness and recovery. Burnout in young athletes is described as a response to chronic stress in which a young athlete stops participating in a previously enjoyable activity. It's also described as emotional and physical exhaustion, reduced sense of accomplishments, and sport devaluation. There are 4 stages in athlete burnout, as described by Smith and colleagues way back in 1986. It starts with an athlete who is placed in a situation that involves varying demands and may end in a situation wherein the various consequences of burnout eventually lead to withdrawal from sports. External and personal factors that increase the risk of mental health issues in athletes have also been implicated in burnout, which may present as ambiguous muscle or joint complaints, fatigue, or poor academic performance. So in addition to evaluating for structural etiology for such complaints, it's also important to assess an athlete's motivation for participating in sports, consider metabolic etiology, and also offer psychological assessment. Early sports specialization has been directly linked to increased rates of burnout in our athletes and is thought to be a contributing factor for early withdrawal from sports, with kids, especially girls, dropping out of sports as young as 11 years old because it's no longer fun. And this is unfortunate because even though I just listed out all the challenges with youth sports participation, the benefits still outweigh these challenges. And so I'd like to end this talk by inviting everyone on this call, as persons of influence in your respective areas of expertise, to join the sports medicine community in promoting safe sports participation for our youth. Everyone can participate, either as healthcare professional, parent advocating for their children, coach, or someone who's involved in youth sports organizations. We have to have consistency in messaging. We recommend or encourage early diversification or sports sampling and free unstructured play, which is helpful for overall neuromuscular development. We also recommend managing their load and avoiding overscheduling and keeping their number of hours of sports per week to less than their age and years. We encourage taking breaks from their sporting activities at least 1 to 2 days per week and at least 2 to 3 months each year, which may be divided into 1-month increments. And also, we emphasize the importance of age-appropriate sports participation for all youth and teens. And for those who find this clinically relevant, I encourage everyone to normalize discussions on mental health, to be transparent with your limitations, and encourage appropriate referrals. For those interested in research, there's still a lot of questions that need to be answered in terms of youth sports. Particularly, is there a right age or a safe age for specialization? And as we work on these ideas for a better future, I hope that everyone thinks about and extends their programs to our underserved communities. With that, I'd like to end my talk. Thank you once again for this opportunity. And I would like to open the floor for questions and further discussion.
Great. Thank you, Dr. De Borja. That was excellent. And yeah, we could open it up for questions if you want to raise your hand, unmute, or send that any questions through the chat.
Hey, Celina, great talk. One question I have for you is, what do you feel are some of the things that we can do as providers to help decrease the disparities in youth sports participation? I think particularly in communities of color, it's very hard, as you mentioned, to access organized sports, especially with no school-based programming. What are some of the tips or resources you think that we can do as clinicians to help decrease that disparity?
Yeah, no, that's a good question, and it's something that's definitely very challenging because it would require a lot of funding, right? Which is what these communities of color are needing the most. I think it's working with institutions or organizations that have resources and making sure that we're extending these resources to these underserved communities. Also, I think encouraging or inspiring these young individuals through outreach activities would be a good idea. They may not see the benefits of sports participation directly, but I think if we educate the community, things could change for the better.
I have a question.
Yeah, Dr. Luke.
Great question. A great talk, Celina. I wanted to, you mentioned about, social media and technology and stuff like that, and how important that is in youth sports. Kind of any thoughts on, how kids are interacting with, these social media and technology things? Some people say it's too much stuff, but now there's wearables and things like that. Is that something that's good for participation or bad for participation?
Yeah, I think definitely technology has its benefits. It helps us become more efficient. It gives us a lot of information, particularly the wearables that, give us information about things like heart rate and our physical activity status. The last time we moved, I, definitely think there's benefits to it, but I think there's also challenges in terms of, what the children are seeing on media and, the examples or who they're trying to mirror in terms of their careers or futures. And so I think it's just being careful with what they access, using technology moderately and carefully.
See a hand up from Dr. Sawyer.
Hi, Celina. Thank you. That was a really excellent talk. And I have a question for you. I'll build up to it for a second here with pediatric bone health knowledge. We really see a challenge in keeping females active, girls active through the teen years. And also that's the same time they tend to drop dairy out of their diet more than boys do. So there's a real challenge to them achieving adequate peak bone mass by decreasing activity and altering their diet. Those 4 years around puberty, you gain 40% of your peak bone mass. So it's a critical time. I'm wondering if you could give us some tips on how people who see children for whatever reason, not just for sports related injuries, could be asking really distinct questions about activity patterns so that we create it almost as a vital sign in our intake process for all the children we see. Do you have any suggestions on that?
Yes, absolutely. So definitely, diet and nutrition is, very important in our young individuals. I particularly ask about special diets or dietary restrictions because that's been found to, become, one of the markers that, may lead to an eventual disordered eating or unhealthy eating practices. And so asking about that, understanding their reason for, practicing these diets, is it religious? Is it cultural? Is it for medical reasons? I think is also very important, and trying to meet them there in terms of educating them about what's healthy and the dangers or pitfalls of following such diets. I think if you get the buy-in of their parents and families, explaining that calcium accrual and towards their bones happen during the teenage or adolescent years, and that we don't really have a chance after that is very important. When the mom can relate, usually they get convinced that they need to increase their calcium and vitamin D intake for their kids. And then in terms of, physical activities, I think just asking broadly, are you involved in organized sports? How many sports do you participate in, and how many teams of each sport do you participate in, just to kind of get a sense of how active they are. If not, you may also want to ask, do you have PE, or do you have any recreational activities that you do with your families? I think that's also a good sense, gives you a good sense of how much energy they're expending. And then especially for those athletes, female athletes, I start discussing the concept of relative energy deficiency in sport, which from low energy availability or low energy intake, can result to a lot of physiologic, but also performance consequences. And sometimes that's what the teenage girls care about, right? They don't care about not getting their periods. They don't care about getting a stress fracture. But if you tell them that it affects their overall performance and their ability to enjoy the things that they love, a lot of times they'll listen.
Sorry, just a quick note. I did send the attendance link through the chat, so please click that if you haven't seen that come through yet. And then see a hand up from Dr. Cheng.
Thanks, Drew. Celina, that was amazing talk. I love seeing the references of Caitlin Ruggs and Nirav Pandya's studies, which I think are really important, especially the ones that talk about the more recent athletes that are coming out, specializing earlier. And so that trend is changing. But in the primary care world, we're used to trying to talk to our adolescent and pediatric athletes or patients without the parents in the room for various topics. So in a busy musculoskeletal practice like what we have, what are some suggestions that you have in terms of how we can do that when it presents with that injury that's not improving? And we know that there may be a burnout component. So I thank you for emphasizing the mental health component of this. But what are some suggestions that you may have for us when we're seeing an athlete back again?
Yeah, thanks, Cindy. That's definitely challenging, right? Given our templates that only allow for 15, 30-minute visits. It may not happen on the initial visit, right? Because our roles, we try to evaluate for structural etiology most of the time. However, if we're sensing that there is an underlying mental health issue and that, further discussion would be important to evaluate the athlete overall, I would do that on the subsequent visits and explain to the families that, talking to the athlete themselves alone would be important in getting their feedback and also understanding their situation better. So I would try to carve out that time, especially, when they're coming back and the history and the exam aren't going to be as long as they were on the initial visit. I would try to carve out that time during the follow-up visits. And then sometimes if, for example, the child is not or the teen is not open to that concept of, emotional or mental health issues contributing to their symptoms because they're so focused into their sport, and they're not realizing that these are manifestations of mental health issues or burnout, I sometimes would speak to the parents to see how they feel about the situation and see, give them a phone call and see, if they get convinced that way.
Thank you.
Sure. Thanks, Cindy. I think Nirav's hand is up.
Yes.
Yeah. One thing, Celina, I think we always struggle with in clinic is telling kids and parents that they're not going to be elite athletes. I know that sounds harsh, but you can use data, you can tell them straight up. What's kind of your spiel with parents when the kids come in and they're getting injured and parents think they're going to get to the major leagues or that next level? What's your kind of go-to talk for them?
Yeah, definitely. That's a very hard, reality to break to some kids who, are very optimistic and have a lot of aspirations. I tell them to really just be themselves and, understand who they are, what kind of player they are. see how that works out in sports. I encourage them to do or have practices that will be helpful for them or be healthy for them, because I tell them that you can't play if you're injured, you can't be recruited if you're out. And so I encourage healthy practices. I try to shift it towards overall health and wellness rather than competition. And then I totally agree, it's kind of difficult to say, well, it's not looking great, but still encourage them still as well, because the benefits are significantly greater. So that's something, again, kind of like to what Cindy was asking earlier, is it's going to be a relationship building before these kinds of messages are relayed. I don't know, Nirav, if you have a style or spiel for that.
No, it's the same sort of way. I think it's a lot of it is just, kind of being evidence-based and showing them, numbers, just the percentage. And I agree. I kind of say that sports are supposed to be for, so you're healthy into your adulthood and when you're 60 or 70 and, going down this path, particularly when it's, you're coming in with your injury at age 10 and 11 and 12. It's trying to be in reality. And I used to kind of sugarcoat it earlier on in my career, but I think it's better to just be straightforward, but respectful, but straightforward with them early on. Yeah.
Exactly.
And then real quick, there are a couple of comments in the chat. Dr. Wostrak just highlighting that this was a great talk, and if you could share your take-home recommendations with the department. And then Dr. Vale also highlighting that it's a great presentation and a holistic approach from the sports group.
Appreciate it.
And then I see a hand up from Dr. Ma.
Thanks, Celina. Great talk over there. Important message. And I don't know, Nirav, I thought every one of us are athletes over here. So, I don't know why do we need to give it up over there. But the challenge a lot of times actually not the kids, challenge is actually the parents. I think most of us know that. I think having the kind of honest opinion, discussion with them is important. So Celina, I want to ask you about the current state right now as we evolve from the pandemic.
Mm-hmm.
What do you see as the impact? Well, we obviously see high school sports not happening in Northern California. And also there are some, hesitancy in terms of letting kids go back to organized sports because of concern about infection,
Mm-hmm.
especially younger kids, when they're not getting vaccinated.
Mm-hmm.
But we'll also understand what the, tremendous impact, like not just physically, but socially, mentally, how they can affect them. What's your advice for parents right now? I think that may be one of the key take home for the faculty, because all of us have young kids or maybe kids we need advice. What do you tell them right now in terms of how we evolve in this pandemic and how we actually deal with it as a community?
Yes, thanks, Ben. This past 2 years has definitely been a unique experience for us in sports medicine. In the beginning, overuse injuries all went away because there was no sports to return to. However, we've now realized that it's going on longer than we expected. And so you're right, the effects of physical inactivity and social isolation has caused worsening of all these challenges that I mentioned earlier. And which is why, the American Academy of Pediatrics has been working really hard to create guidelines that overall favor or promote, back to in-person school and, returning to participating in activities to help with all these negative impacts of the pandemic. Understanding that there's a lot of unknown variables. But what I tell families or parents is that, participate in what you feel is comfortable, for your preference. If you're not ready to engage in an organized sport or in a team, then, I definitely encourage recreational activities that will increase physical fitness. So hiking, biking, anything that'll get them moving. Studies show that outdoor sporting activities are less likely to transmit the virus. And so that's something that I share with the families. In those instances wherein breakouts happened, it wasn't during the sporting activity, but it was after the sporting activity where, they would get together, share meals or carpool unmasked. So, just being careful and knowing those protective efforts. And that, indoor sports are a little bit more risky in terms of sporting activities. So I try to, share with them that kind of information. And I essentially let them choose whatever they're comfortable with. Because at the end of the day, it's their children, it's their families, and you want to do what's best for them. But I still encourage movement and seeing other people if possible, because the kids have definitely suffered a lot in these past 2 years.
There's another comment in the chat from Dr. Alahabadi, just highlighting the role that professional athletes can have and emphasizing like multi-sport participation, and that can be pretty impactful on kids as well. Completely agree with that. And then I see a hand up from Dr. Edwards.
Hi, thank you. Yeah, I think that was a great talk. It's such a topic near and dear to my heart. And I find as a parent, and this kind of echoes what Ben is saying, I find it really challenging to kind of manage these, because as kids enter their sports life now, all these sports are multiple, right? Or I'm sorry, the multiple sports, they're all year round. And so when you say, I'm going to be a multiple sport athlete, sometimes that means the kid has 6 hours of practice on a Sunday running from sport to sport. And I find that extremely challenging just logistically to do that, but also they're getting overused from being in multiple sports. So how is that? I think we're missing the boat a little bit when we say multi-sport is good, single sport is bad, because it's more just too much exposure overall. But I don't know how we partner with these, this billion-dollar industry to try to get them to back it down. It's a shame the sports have been lost from the schools, but I don't know how to solve that problem. I hope we can come up with some research to help. But
yes, thanks, Sarah. That's definitely a challenge, especially in our area where it's great weather and we can play all kinds of sports all year round. I remember when I was, training in the East Coast, sports season changed as the months changed. And so, no one was playing outdoor sports in the winter, everyone was indoors. And so that somewhat helped with the overscheduling or, overuse issue, because they're only involved in one activity at a time. Whereas here in the West Coast, you can play baseball all year round. And at first that was something that was confusing to me, because patients were coming to me with injuries from sports that weren't even in season, but I then realized that we do it all year round. So I think it's just, trying to look at the schedule on like a bigger level, in a yearly level, and trying to allocate time for each sporting activity and try not to do them all in the same season if that's possible.
Great. And just a reminder again, if you've tried the link for attendance, it will be active once the session is over, so at 8:30. So maybe just keep that and refresh it. And any other comments, questions, thoughts? And just another one coming through the chat from Dr. Asturias, and thanking you for the talk, and highlighting, especially in there's some sports that are especially prone to early specialization. All right, and I think with that, we will likely wrap up for today. We'll be back next week with Dr. Lauren Shapiro, one of our hand surgeons, who will be presenting for Grand Rounds next week. So thank you all for being here, and see you then.
Thank you, everyone. Have a good day.
Thanks, Dr. De Borja.